Hello, welcome to this week's editions of Rare Diseases, where we take rare diseases and show you how to do a nice nursing care plan. On this week's edition, we're going to cover abetalipoproteinemia. That is a hereditary disease that inhibits the absorption of fat. The following clip we're going to show you, we're going to do it a little bit different this week. It's going to be an actual collaborative care plan that you're going to see different people from different healthcare professionals come together to make a care plan for this patient. Enjoy.
I'm a social worker working with our patient with abetalipoproteinemia, and honestly, I'm not really sure what's going on with that patient, so does anybody want to give me a rundown on their care?
I can. I'm the nurse for this patient. So we're working with a 15-year-old male who has abetalipoproteinemia, and basically this is a recessive autosomal disease that causes a mutation in the DNA, and it just basically tells the body not to absorb and digest the fats like it's supposed to. It's pretty rare. There's only like 100 cases per year, and this patient was born with this disease. They probably seen a lot of signs and symptoms in infancy where the patient was probably labeled failure to thrive. They probably had some like malnourished symptoms. The way that they diagnosed this is they did a CBC where we looked at their cholesterol levels and whether or not they had anemia, because the blood plays into that production of those red blood cells and whatnot. And they also could have done like what they call get a stool sample and see if there's a lot of fat being passed into the stool, which means that they're not absorbing it properly.
Okay.
So what we see with this patient is that he's very young. He's got a lot of issues with his eyes because he doesn't have that fat production. Because they're not able to absorb that fat, he's not going to have A, D, E, and K levels where they're supposed to be. So most people go blind by the age of 40 with this disease. You also see stuff like kyphosis in early age, ataxia, those types of things, because we're not having that influx of vitamins in the fat to properly build the body processes that we need to. There's not a lot of pharmacological interventions that we can do with this. Because there's not a lot of medications out there that really help the absorption of those things. So we're really focusing on diet and supplemental.
Okay, sounds good. So for post-discharge care, I'm really worried about them being able to get these nutrients and where they should get these nutrients from their, food, or if they need supplements. And I'm worried about access to them. So does anybody have any input on that? The nutritionist, maybe?
Yeah. So because he does have a lack of vitamins in his body, we want to focus on putting them back in. So we will probably put him on a couple supplements, focusing on the fat-soluble vitamins A, D, E, and K. A for his eyes, because like Jordan said, he's going to have some difficulty with his eyes. D for his bones and bone absorption, E for more of an antioxidant, and K for clotting. That's a big thing we need to focus on. Some foods that we want him to stay away from are more of the fatty foods, like the fattier meats and dairy products, a lot of dairy products, because he can't absorb them well. So like his ice creams, his cream cheeses, those are no good for him, so we're going to stay away from those. We want him to be more on plant-based foods, so like broccoli, cauliflower, spinach, even almonds are a good source for him to eat. We will have to do blood tests because we are giving him the supplements. We don't want him to have too many in his body because they can be toxic, so we'll have to do blood tests often. But like I said, we want him to get them through his foods mainly, but again, the supplements will help, so we want to keep that in mind, and we'll have to let him know that his diet will have to change in order for him to continue to grow and function as a teenage boy.
Okay, thank you very much. I will focus on making sure that they have access to all that and that they know what they need, and I will present them with brochures and information. Thank you. And obviously, they're going to have some hard times, socially. So, does anybody have any recommendations for that or some coping skills?
Yeah, I do. Some of the psychosocial concerns for him being such a young teenage boy is with the eye problems and mobility issues. There are programs for him to take that will get him, active. There are therapies where he could do like moving in water, pool activities, so it's less stress on the body. We're also concerned about him maybe possibly doing counseling as soon as he's discharged, starting getting him phone numbers and places where he can go. Also encouraging parents and the school that he will be going to, make them aware of the situation, and potentially getting him started on like extracurricular activities that won't be so harsh for him that he's capable of doing. Another coping mechanism will also be the influence the family has with him and the understanding they provide for the generalization of the disease. Another concern would also be if the family has any cultural or food related concerns while he's here, like does he want to see a chaplain or for spirituality care, what could we best do while he's here, as well as we still have to find out if he will accept blood transfusions, which I'm sure we can figure out later. And I think for right now, our biggest concern is just how well he copes with it as he learns and grows and develops more of the disease as he gets older. So
Okay. For his post-discharge care, I can put together some support groups and stuff, and maybe some online forums, as well as some recommendations for exercise and stuff. See if he wants any spirituality, supplements outside of our care. So thank you for your input. And finally, I wanted to know about family education. Well, like what we can do for them that way.
That would be my expertise. My name is Livia. I'm the educator for a local hospital. So family support is big with this disease process, because not only is like the diet a big part, which the whole family is going to have to change, but it's just a major emotional, all around big change in the whole family. So we want to make sure, just for discharge, that the care of the patient is very important. So like making sure that, since he is only 15, getting to like his ophthalmologist appointments and his neurologist appointments every year is very important, because as Jordan said, he's going to have problems. He already has problems with his eyes, and then neuromuscular is just going to decrease as he gets older, just because that's how the disease process works with the malnutrition. I mean, we're going to try and supplement as best as possible, but the reality of the situation is that most times they are very malnourished because they can't absorb those vitamins. So we also want to do a lot of teaching about weight-bearing exercises for physical therapy to keep that musculoskeletal system intact, and so he could still do his ADLs and stuff like that. And then we also want to explain to separate his activities for the day, spread them out so he's not doing them all at once, because that can be very strenuous and he'll be very tired. So if he separates them throughout the day, he should be okay. Gives him rest periods in between. Along with diet, a lot of the GI issues come from, as the nutritionist is saying, the cheeses and dairy and the fatty meats, and we really want to stay away from those. So again, educating the family on what types of food and giving them the resources they need to be doing all of those things.
Okay, so just to summarize our meeting, I will be taking care of post-discharge care. So I'm gonna let them know that there's not many, pharmacological interventions that we can do, but we will need to get it through the diet, and we need to make sure that they have those resources so I can set them up with a food assistance program if need be. Also, we're gonna need some, spiritual aspects incorporated, so I can see what they need and maybe find programs that will work for them, as well as, finding what care they would accept and would not. And then we need to get into an ophthalmologist early and often, and consistently. So I will try to set them up with an ophthalmologist that accepts their insurance program, and
That's a good idea.
get them in as frequently as needed, and also PT, physical therapy. See if they can get some weight bearing exercises in, and aerobics or whatever is needed for them. And I think that pretty much concludes it. We're gonna focus on diet and try to provide the best care possible.
Sounds
Thank
like a
you,
plan.
Lynn. Thank you all.
Wasn't that fabulous? Seeing all those disciplines coming together to make a care plan for a patient. It was absolutely wonderful. I would like to give a special thanks to Olivia, the nurse educator, Jessica, the nutritionist, Alejandra, the counselor, Emma, the social worker, and Jordan, the nurse. We hope you enjoyed this week's episode, and we hope you'll come back to join us for next week's episode. Have a good day.